question, should we be asking our doctors during the perimenopausal transition to, test for diabetes, etc.? And I think, it's something that will eventually happen more frequently as we're starting to understand a little bit more about, who's at risk of diabetes or metabolic disorders. Because a lot of times, this is based on someone's BMI, if they're at higher risk. And I think we're missing a large proportion of the population that way. And this becomes especially true in women who are going through the menopausal transition, or maybe more so once they are actually postmenopausal, because, they've lost a certain amount of muscle mass, of bone mass, and they've potentially gained some fat mass. And that actually skews the BMI a little bit. So it might seem that someone is a healthy weight, but in fact, they might have metabolic dysfunction. So I think that more and more, and we think about this by looking at, about 30% of healthy weight women actually have metabolic dysfunction to the point where they're potentially, pre-diabetic. They have a certain state of low-grade inflammation already without even knowing it based on their BMI alone. So potentially we would be going in that direction, hopefully, as, medicine catches up to, some of the science that's been, I guess, talked about more recently.